Welcome to Health Simplified, where we unravel the mysteries of health and empower you to take charge of your well-being.
Sounds good.
Today, we're diving deep into a condition that's often misunderstood:
Okay.
hyperinsulinemia. Get ready to move beyond the basics as we explore its stages, delve into potential complications, and navigate the landscape of diagnosis and treatment.
Yeah, it's true that hyperinsulinemia often gets simplified to just meaning high insulin levels,
Right.
but it's a much more intricate story with wide-ranging implications for our metabolic health. It's like a domino effect, triggering a cascade of events that can lead to serious health concerns if left unaddressed.
So it's not just about excess insulin.
Right.
There's a whole chain reaction happening within the body. This deep dive is already sounding more complex than I initially thought.
Yeah.
To really grasp the nuances of hyperinsulinemia, let's start by understanding what happens when things are working as they should. Can you walk us through how insulin is produced in the body?
Absolutely. Imagine your pancreas as a bustling factory with specialized cells called pancreatic islets working tirelessly to produce insulin. These islets are like tiny, intricate machines, carefully orchestrating the production of this vital hormone.
Okay, so the pancreas is our insulin factory.
Yes.
But how does this factory actually produce insulin? What are the steps involved?
It's a fascinating multi-step process. It all starts with a precursor molecule called preproinsulin, which is like the raw material. This preproinsulin undergoes a series of transformations, like a sculptor chiseling away at a block of marble to create a masterpiece.
I love that analogy.
Yeah.
So we have this raw material, preproinsulin. What happens next?
Preproinsulin enters a cellular compartment called the endoplasmic reticulum, where a specific section called the signal peptide is snipped off. Think of it like removing the rough edges. This transforms preproinsulin into proinsulin.
So it's like a refining process. What happens to proinsulin? Does it become insulin directly?
Not quite. Proinsulin travels to another cellular station, the Golgi apparatus, where it undergoes further modifications. It's like adding the finishing touches to a sculpture. This process results in the formation of insulin, our key player, and another molecule called C-peptide.
C-peptide. Is that something doctors look at when diagnosing hyperinsulinemia?
It can be.
Okay.
C-peptide is often measured in conjunction with insulin levels. It's like a sidekick to insulin, providing valuable clues about how much insulin the body is producing.
This is already giving me a much deeper appreciation for the complexity of insulin production.
Yeah.
But once insulin is made, how does it actually work in the body?
Right.
What's its main function?
Insulin acts like a key, unlocking cells to allow glucose, our primary source of energy, to enter. Without insulin, glucose can't effectively enter cells, leading to elevated blood sugar levels.
So insulin is essentially a gatekeeper for glucose, ensuring our cells get the fuel they need.
Exactly.
What triggers the release of insulin from the pancreas?
Okay.
I imagine it's not a constant strain.
You're right. Insulin release is tightly regulated. When we eat, especially foods rich in carbohydrates, our blood sugar levels rise. This increase in blood sugar acts as a signal prompting the pancreas to release insulin.
It's like a sophisticated feedback loop. Blood sugar goes up, insulin is released to bring it back down.
Exactly.
But you mentioned earlier that other factors can influence insulin production as well. Can you elaborate on that?
It's not just glucose that plays a role. Certain amino acids, the building blocks of proteins, can also stimulate insulin release. And even free fatty acids, which come from the breakdown of fats, can contribute to insulin secretion.
So it's a more complex interplay than just glucose driving insulin release.
Yes.
This already hints at the delicate balance that can be disrupted in hyperinsulinemia. But before we delve into what goes wrong, let's explore how insulin actually interacts with cells.
Sure.
What happens at the cellular level when insulin is released into the bloodstream?
That's where things get really fascinating. Insulin doesn't just float around aimlessly. It has specific targets. Insulin receptors, which are like docking stations located on the surface of cells.
So insulin has to bind to these receptors to exert its effects. What happens once insulin docks at these receptors?
That binding event triggers a chain reaction within the cell, activating intricate signaling pathways. These pathways are like communication networks, relaying messages from insulin to various parts of the cell. The two major players in this cellular communication system are the PI3K-AK2 pathway and the EPI-KEEP pathway.
I've heard of these pathways before, but never really understood what they do. Can you break them down for us?
Imagine these pathways as elaborate domino effects, with each step triggering the next. The PI3K-AKT pathway is primarily involved in regulating glucose and lipid metabolism. It helps cells absorb glucose from the bloodstream, promotes the storage of glucose as glycogen, and even influences the synthesis of proteins and fats.
That's a lot of responsibility. And what about the MPK pathway? What's its role?
While the PI3K pathway focuses on metabolism, the MAKK pathway is more concerned with cell growth and proliferation.
Oh, all right.
It's involved in processes like cell division and the production of new proteins.
So we have these two intricate pathways, PI3K-AKT and MAKK, relaying messages from insulin and influencing a wide range of cellular processes.
Yes.
This is already starting to paint a picture of how disruptions in these pathways could lead to problems.
Exactly.
Knowing how essential these pathways are, what happens when things go wrong?
Well,
When does hyperinsulinemia enter the picture?
hyperinsulinemia occurs when the body produces too much insulin, exceeding what's needed to regulate blood sugar effectively. This can happen for various reasons, and the consequences can be significant.
So too much insulin is the problem. Isn't insulin a good thing?
Right.
We need it to control blood sugar. Why is having too much a bad thing?
It's all about balance. Insulin is essential, but like anything in the body, too much of a good thing can become a problem. When insulin levels are chronically elevated, cells can become resistant to its effects.
Resistant. What does that mean exactly?
Imagine you keep knocking on a door, but no one answers.
Yeah.
Eventually, you might stop knocking altogether. Similarly, when cells are constantly bombarded with insulin, they can become less responsive to its signals. This is known as insulin resistance.
It's like the cells are tuning out the message.
Exactly.
So hyperinsulinemia and insulin resistance are connected.
They're intertwined in a complex dance. It's like a chicken and egg scenario. Scientists are still debating which one comes first in humans.
Oh, wow.
Does hyperinsulinemia lead to insulin resistance? Or does insulin resistance trigger hyperinsulinemia? The answer might be different for different people.
That's fascinating and a little perplexing. But we're starting to see how this interplay between hyperinsulinemia and insulin resistance can set the stage for metabolic mayhem. Before we go further down that road, let's talk about the stages of hyperinsulinemia. Are there different levels of severity?
While there isn't a universally recognized staging system for hyperinsulinemia, we can think of it as a spectrum. At one end, you might have mildly elevated insulin levels, often with no noticeable symptoms. At the other end, you might have severely elevated insulin levels, accompanied by a range of metabolic disturbances.
So it's not just a black and white diagnosis. There are shades of gray. What factors determine where someone falls on that spectrum?
Multiple factors contribute. Genetics plays a role, as some people are predisposed to producing more insulin. Lifestyle factors such as diet and physical activity also play a significant role. And certain medical conditions like polycystic ovary syndrome, PCOS, can increase the risk of hyperinsulinemia.
It's a complex interplay of nature and nurture.
Yeah.
This is already highlighting the importance of personalized medical care. What are some of the complications that can arise as hyperinsulinemia progresses?
As insulin resistance develops, the body struggles to regulate blood sugar effectively, setting the stage for prediabetes and eventually type 2 diabetes. But the complications extend far beyond blood sugar control.
This is where it gets really concerning.
Yeah.
So what other health problems can hyperinsulinemia contribute to?
Hyperinsulinemia is linked to an increased risk of cardiovascular disease,
Oh, wow.
including heart attacks and strokes. It can also contribute to high blood pressure, high cholesterol, and non-alcoholic fatty liver disease. And some studies suggest a potential link between hyperinsulinemia and certain types of cancer.
This is a sobering reminder that hyperinsulinemia is not something to be taken lightly.
No.
It's a condition that can have far-reaching consequences for our health. Knowing this, how do doctors diagnose hyperinsulinemia? What tests are involved?
Diagnosing hyperinsulinemia can be tricky. There's no single test that definitively confirms the diagnosis. Doctors often rely on a combination of factors, including medical history, physical examination, and blood tests.
So it's a holistic approach, considering the whole picture. What kind of blood tests are typically ordered?
The most common test is a fasting insulin level. As the name suggests, this test measures insulin levels after an overnight fast. Elevated fasting insulin levels can be a sign of hyperinsulinemia.
So if someone's fasting insulin level comes back high, does that automatically mean they have hyperinsulinemia?
Not necessarily. Fasting insulin levels can vary depending on factors like age, gender, and body mass index. Doctors also consider other blood tests, such as fasting glucose and HbA1c, which provide information about blood sugar control.
So it's not just about a single number.
Right.
It's about interpreting the results in context.
Exactly.
This underscores the importance of consulting with a qualified healthcare professional. Are there any other tests doctors might use to assess for hyperinsulinemia?
Sometimes doctors might order a glucose tolerance test. This test involves drinking a sugary solution and then measuring blood glucose and insulin levels at specific intervals. It helps assess how the body responds to a glucose challenge.
It's like putting the body's insulin response to the test. That makes sense. Now that we have a better understanding of how hyperinsulinemia is diagnosed, let's shift our focus to treatment. What are the main treatment approaches for this condition?
The good news is that lifestyle modifications are often the first line of treatment for hyperinsulinemia, and they can be incredibly effective.
This is encouraging. What kind of lifestyle changes are we talking about?
The two cornerstones of treatment are dietary changes and increased physical activity. Think of these as the dynamic duo for combating hyperinsulinemia.
This is starting to sound familiar.
Yeah.
These are often recommended for overall health. But how do they specifically target hyperinsulinemia?
Let's start with diet. The goal is to reduce the burden on the pancreas and improve insulin sensitivity.
Okay, so we want to give the pancreas a break and help cells respond better to insulin.
Right.
What kind of dietary changes can help achieve this?
There are various dietary approaches that can be beneficial. Some people find success with a low-carbohydrate diet, as carbohydrates have the most significant impact on insulin levels. Others might benefit from a low-fat diet or a Mediterranean-style diet rich in fruits, vegetables, and healthy fats.
So it's not a one-size-fits-all approach.
Exactly.
There are different dietary paths that can lead to improved insulin sensitivity. This is where working with a registered dietitian can be incredibly helpful.
Absolutely.
They can tailor a dietary plan that aligns with individual needs and preferences. Now let's talk about exercise. How does physical activity fit into the treatment plan for hyperinsulinemia?
Physical activity is like a magic bullet for insulin sensitivity. When you engage in regular exercise, your muscles become more efficient at taking up glucose, reducing the demand on the pancreas to produce insulin.
It's like giving your cells a workout, making them better at their job. What kind of exercise is most effective for managing hyperinsulinemia?
A combination of aerobic exercise and strength training is ideal. Aerobic activities like brisk walking, swimming, or cycling get your heart pumping and improve cardiovascular health. Strength training, like lifting weights or using resistance bands, builds muscle mass, which further enhances glucose uptake.
So it's about finding activities you enjoy and incorporating them into your routine consistently. But are there any specific types of exercise that are particularly beneficial for improving insulin sensitivity? What about high-intensity interval training, HIT? I've heard that can be quite effective.
HIIT has gained popularity for its ability to improve insulin sensitivity in a shorter amount of time. It involves alternating between short bursts of intense exercise and recovery periods, but it's essential to consult with your doctor before starting any new exercise program, especially if you have any underlying health conditions.
That's sound advice. Safety first. Now, we've talked about diet and exercise as cornerstones of treatment for hyperinsulinemia. Are there any other lifestyle factors that can influence insulin regulation?
Absolutely. Sleep, stress management, and even exposure to environmental toxins can impact insulin sensitivity.
This is where the holistic approach to health really comes into play. Let's start with sleep. How does lack of sleep affect insulin?
When you're sleep deprived, your body produces more of the stress hormone cortisol.
Okay.
Cortisol can interfere with insulin signaling, leading to insulin resistance. Aim for 7 to 9 hours of quality sleep each night to support healthy insulin regulation.
It's good advice for everyone, not just those with hyperinsulinemia. What about stress? How does it play into the equation?
Stress also triggers the release of cortisol, which, as we just discussed, can hinder insulin sensitivity. Find healthy ways to manage stress, such as meditation, yoga, deep breathing exercises, or spending time in nature.
Stress reduction is essential for overall well-being. And you mentioned environmental toxins. What's the connection there?
Certain environmental toxins, such as bisphenol A, BPA, and E-phthalates, have been linked to insulin resistance. These chemicals are found in many everyday products, from plastic containers to personal care products. It's a reminder that our health is interconnected with our surroundings.
It's mind-boggling to think that even things in our environment can influence our metabolic health.
Right.
This is all incredibly insightful. But I'm curious, are there any medications used to treat hyperinsulinemia?
While lifestyle interventions are the cornerstone of treatment, medications might be considered in some cases.
Hmm.
Metformin, a drug commonly prescribed for type 2 diabetes, can sometimes be used to improve insulin sensitivity.
So medication might be part of the toolkit, but it's not a magic bullet.
Exactly. It's about addressing the root cause, which often lies in lifestyle factors. Now, before we wrap up this part of our deep dive, I want to emphasize that managing hyperinsulinemia is a long-term commitment.
It's not a quick fix.
Right. It requires ongoing attention to diet, exercise, stress management, and other lifestyle factors. But the rewards are well worth the effort. By taking proactive steps to address hyperinsulinemia, you can reduce your risk of developing prediabetes, type 2 diabetes, and other serious health conditions.
That's a powerful message of empowerment. We have the ability to take control of our metabolic health. And remember, we'll be back with part 2 of this deep dive, where we'll explore more about the nuances of hyperinsulinemia and its impact on our health. Stay tuned.
Great. Welcome back to our deep dive into hyperinsulinemia. In the previous segment, we explored the intricate process of insulin production and how it interacts with cells. We also started to unravel the complex relationship between hyperinsulinemia and insulin resistance.
It's like we've peeled back the first layer of the onion and discovered a whole new level of complexity. I'm eager to delve deeper into the consequences of hyperinsulinemia and explore practical strategies for managing this condition.
It's a crucial topic, and one that deserves more attention than it often receives. Many people are unaware of the potential health risks associated with hyperinsulinemia, dismissing it as a simple matter of high insulin levels. But it's much more than that.
I think that's what makes this deep dive so valuable. We're moving beyond the surface level and really getting into the nitty-gritty of what hyperinsulinemia means for our health. We've already touched on some potential complications, like the increased risk of prediabetes and type 2 diabetes, but you mentioned that hyperinsulinemia can also contribute to a range of other health problems.
It's true. Hyperinsulinemia is like a domino effect, setting off a chain reaction that can impact various systems in the body. One of the most concerning consequences is its link to cardiovascular disease.
Cardiovascular disease, that's a broad term. Can you be more specific? What kinds of heart problems are we talking about?
Hyperinsulinemia is associated with an increased risk of heart attacks, strokes, and even heart failure. It can contribute to the buildup of plaque in the arteries, a process known as atherosclerosis, which restricts blood flow and increases the risk of these serious cardiovascular events.
So it's not just about blood sugar control. Hyperinsulinemia can directly impact the health of our hearts and blood vessels. That's a serious wake-up call. Are there any other health problems linked to hyperinsulinemia?
Hyperinsulinemia is also associated with high blood pressure, or hypertension, which puts additional strain on the heart and blood vessels. It can contribute to high cholesterol levels, particularly elevated triglycerides and low levels of HDL cholesterol, the good cholesterol. And it's linked to non-alcoholic fatty liver disease, a condition in which fat accumulates in the liver, potentially leading to liver damage.
Wow, the list of potential complications keeps growing. This is really painting a clear picture of the far-reaching consequences of hyperinsulinemia. It's amazing how a seemingly isolated hormonal imbalance can have such a ripple effect throughout the body. Knowing this, what can people do to protect their health? What are some effective strategies for managing hyperinsulinemia?
The good news is that many effective strategies exist for managing hyperinsulinemia and reducing the risk of these complications. As we discussed in the previous segment, lifestyle modifications are often the first line of treatment.
Lifestyle modifications, that's a broad term. What exactly does it encompass?
Lifestyle modifications involve making changes to your daily habits, such as your diet, exercise routine, sleep patterns, and stress management techniques.
So it's about taking a holistic approach to health, considering all aspects of our lives. Let's break down each of these areas and explore specific strategies for managing hyperinsulinemia. Starting with diet, what are some key dietary changes that can make a difference?
When it comes to managing hyperinsulinemia through diet, the primary goal is to reduce the burden on the pancreas and improve insulin sensitivity. This means choosing foods that have a minimal impact on blood sugar levels and promote stable insulin production.
Okay, so we want to avoid those dramatic spikes in blood sugar that overwork the pancreas and lead to insulin resistance. What types of foods should we be focusing on?
One effective approach is to focus on foods that are low in carbohydrates, particularly refined carbohydrates and sugars. These types of carbohydrates are quickly digested and absorbed, leading to rapid increases in blood sugar and insulin levels.
So things like white bread, pasta, sugary drinks, and processed snacks are off the menu.
It's best to limit these types of foods as much as possible. Instead, prioritize complex carbohydrates, such as those found in whole grains, fruits, and vegetables. Complex carbohydrates are digested more slowly, resulting in a more gradual rise in blood sugar and insulin levels.
That makes sense. So it's not about completely eliminating carbohydrates, but rather choosing the right types of carbs. What about protein and fat? How do they fit into the equation?
Protein and fat play important roles in a balanced diet for managing hyperinsulinemia. Protein is digested slowly and has a minimal impact on blood sugar levels. Healthy fats, such as those found in olive oil, avocados, nuts, and seeds, can help improve insulin sensitivity.
So, a balanced diet rich in complex carbohydrates, lean protein, and healthy fats is the foundation for managing hyperinsulinemia. Are there any specific dietary patterns or approaches that are particularly beneficial?
Several dietary patterns can be helpful. Some people find success with a low carbohydrate diet, which involves restricting carbohydrate intake to less than 130 grams per day. This can be an effective way to reduce insulin levels and promote weight loss, which often improves insulin sensitivity.
Low-carb diets have gained a lot of attention in recent years, but they can be quite restrictive. Are there any other options for people who prefer a less restrictive approach?
Absolutely. The Mediterranean diet, which emphasizes fruits, vegetables, whole grains, legumes, nuts, and olive oil, is another excellent choice. This diet is rich in antioxidants and healthy fats, which have been shown to improve insulin sensitivity and reduce inflammation.
The Mediterranean diet is often touted for its overall health benefits. It's encouraging to know that it can also be beneficial for managing hyperinsulinemia. Now, let's move on to exercise. We've already touched on how physical activity can improve insulin sensitivity. But I'm curious, how does exercise actually achieve this? What's happening at the cellular level?
Exercise is like a magic bullet for insulin sensitivity, working on multiple fronts to enhance the body's ability to use insulin effectively. When you engage in physical activity, especially aerobic exercise, your muscles demand more energy. To meet this increased demand, your muscles become more efficient at taking up glucose from the bloodstream, even without relying heavily on insulin.
So it's like exercise trains the muscles to become more independent, reducing their reliance on insulin to absorb glucose. That's fascinating. Are there any other ways exercise improves insulin sensitivity?
Exercise also helps improve body composition, particularly by reducing body fat and increasing muscle mass. Excess body fat, especially visceral fat, the type that surrounds your internal organs, is a major contributor to insulin resistance. By reducing body fat through exercise, you're essentially removing a roadblock to insulin sensitivity.
It's like clearing the path for insulin to do its job effectively. And how does increasing muscle mass contribute to better insulin sensitivity?
Muscle tissue is more metabolically active than fat tissue, meaning it requires more energy to function. This means that even at rest, muscles are constantly taking up glucose from the bloodstream, helping to keep blood sugar levels stable.
So the more muscle mass you have, the more efficient your body becomes at utilizing glucose. It's like having a bigger engine that burns more fuel. That's a great incentive to incorporate strength training into your routine. We've talked about aerobic exercise and strength training. Are there any specific recommendations for the frequency, intensity, and duration of exercise for managing hyperinsulinemia?
The general recommendation is to aim for at least 150 minutes of moderate intensity aerobic exercise, or 75 minutes of vigorous intensity aerobic exercise per week. This can be spread out over several days. Strength training should be done at least twice a week, targeting major muscle groups.
So consistency is key. It's about finding a balance that works for you and sticking with it. Are there any specific types of exercise that are particularly beneficial for improving insulin sensitivity? What about high-intensity interval training, HIIT? I've heard that can be quite effective.
HIIT has gained popularity for its ability to improve insulin sensitivity in a shorter amount of time. It involves alternating between short bursts of intense exercise and recovery periods.
So it's like giving your metabolism a jolt. That sounds intriguing. But is HIIT safe for everyone?
It's essential to consult with your doctor before starting any new exercise program, especially if you have any underlying health conditions. HIIT can be quite demanding on the body, so it's important to start slowly and gradually increase the intensity and duration of your workouts.
That's sound advice. Safety first. We've discussed diet and exercise extensively. But you mentioned other lifestyle factors that can influence insulin regulation. Let's delve into those. Starting with sleep. How does lack of sleep affect insulin sensitivity?
Sleep is often overlooked when it comes to metabolic health, but it plays a crucial role in regulating hormones, including insulin. When you're sleep deprived, your body produces more of the stress hormone cortisol. Cortisol can interfere with insulin signaling, leading to insulin resistance.
So it's like a double whammy.
Yeah,
Lack of sleep increases stress hormones, which then disrupt insulin's ability to do its job. How much sleep do we need to maintain healthy insulin sensitivity?
most adults need between 7 and 9 hours of quality sleep each night.
That's a good reminder to prioritize sleep. It's not a luxury, it's essential for our health. What about stress? How does stress impact insulin regulation?
Stress, like lack of sleep, triggers the release of cortisol, which, as we discussed, can contribute to insulin resistance. Chronic stress can keep cortisol levels elevated, making it harder for the body to regulate blood sugar effectively.
It's like stress throws a wrench in the whole metabolic machinery. This highlights the importance of finding healthy ways to manage stress. What are some effective stress reduction techniques?
There are countless ways to manage stress. Some people find solace in meditation, yoga, or deep breathing exercises. Others prefer spending time in nature, listening to music, or pursuing creative hobbies. The key is to find activities that help you unwind and de-stress.
It's about finding what works for you and making it a regular part of your routine. You also mentioned environmental toxins as a potential factor in insulin resistance. Can you elaborate on that? What types of toxins should we be aware of?
Certain environmental toxins, such as bisphenol A, BPA, and phthalates, have been linked to insulin resistance. These chemicals are found in many everyday products, from plastic containers to personal care products. BPA is often found in food packaging, water bottles, and even toys. Phthalates are used to make plastics more flexible and are commonly found in cosmetics, personal care products, and even some food packaging.
It's alarming to think that these chemicals are so pervasive in our environment. What can we do to minimize our exposure?
There are steps you can take to reduce your exposure to these potentially harmful chemicals. Choose BPA-free products whenever possible, such as water bottles and food storage containers. Opt for personal care products that are phthalate-free. And consider filtering your water to remove potential contaminants.
These are practical tips that everyone can implement. It's about making informed choices and being mindful of the products we use and the foods we eat. Now, we've covered a lot of ground in this deep dive into hyperinsulinemia. We have explored its causes, consequences, and treatment options. Is there anything else our listeners should keep in mind when it comes to managing this condition?
I want to emphasize that managing hyperinsulinemia is a journey, not a destination. It requires ongoing attention to lifestyle choices and regular monitoring of your health.
It's not a one-and-done situation. It's about making sustainable changes that become part of your everyday life. What are some key takeaways for our listeners to remember as they embark on this journey?
Remember that you have the power to take control of your metabolic health. Embrace a balanced diet, prioritize regular physical activity, get enough sleep, manage stress effectively, and be mindful of environmental toxins.
These are powerful messages of empowerment. By making conscious choices and adopting healthy habits, we can significantly reduce our risk of developing hyperinsulinemia and its associated health problems. Before we wrap up this part of our deep dive, are there any parting words of wisdom you'd like to share with our listeners?
Listen to your body. Be aware of any changes in your energy levels, mood, or physical well-being. Don't hesitate to reach out to your healthcare provider if you notice any concerning symptoms or have questions about your metabolic health. Early detection and intervention are key to preventing complications and living a long, healthy life.
That's great advice. It's about being proactive and taking charge of our health. Thank you for sharing your expertise with us today. We'll be back with the final part of our deep dive into hyperinsulinemia, where we'll explore emerging research and potential future directions for managing this condition. Stay tuned. Welcome back to Health Simplified. We're wrapping up our deep dive into hyperinsulinemia, a condition that's more complex and impactful than many people realize.
It's true that hyperinsulinemia often flies under the radar, but as we've discussed, its effects are far-reaching, potentially leading to serious health consequences if left unaddressed.
In the previous segments, we unraveled the intricacies of insulin production, explored the interplay between hyperinsulinemia and insulin resistance, and delved into the potential complications associated with this condition. We also discussed a range of lifestyle modifications that can help manage hyperinsulinemia and improve metabolic health.
We've covered a lot of ground, providing a solid foundation for understanding this complex metabolic condition. But before we wrap up our deep dive, I'd like to touch on a few important points that often get overlooked in discussions about hyperinsulinemia.
I'm all ears. What are some of the nuances that we haven't yet explored?
One crucial point is that hyperinsulinemia is not a one-size-fits-all diagnosis. There are different subtypes of hyperinsulinemia, each with its own unique characteristics and potential implications.
Subtypes. That's intriguing. I thought hyperinsulinemia was simply defined as having too much insulin in the blood. Can you elaborate on these subtypes?
One way to categorize hyperinsulinemia is based on the underlying cause. For example, some people have a genetic predisposition to producing more insulin, a condition known as familial hyperinsulinemia. Others develop hyperinsulinemia as a consequence of insulin resistance, as the body tries to compensate for the cell's reduced sensitivity to insulin.
So the root cause can vary from person to person. Does this mean that the treatment approach might also differ depending on the subtype of hyperinsulinemia?
That's an excellent question, and the answer is yes. The most effective treatment strategy will depend on the underlying cause and the individual's specific circumstances. For instance, someone with familial hyperinsulinemia might require different medications or lifestyle interventions than someone whose hyperinsulinemia is driven by insulin resistance.
This highlights the importance of personalized medical care. It's not about a one-size-fits-all approach. It's about tailoring the treatment plan to the individual's unique needs. Are there any other important points that we should keep in mind when it comes to hyperinsulinemia?
Another crucial point is that hyperinsulinemia is often a silent condition, meaning that many people don't experience any noticeable symptoms in the early stages.
Silent. So people could have this condition brewing beneath the surface without even knowing it. That's a little unsettling. Why is it often asymptomatic in the early stages?
In the initial stages of hyperinsulinemia, the body is often able to compensate for the excess insulin by increasing glucose uptake into cells. This helps maintain blood sugar levels within a relatively normal range, masking the underlying metabolic imbalance.
It's like the body is working overtime to keep things in check, but eventually this compensatory mechanism can't keep up.
Exactly. As hyperinsulinemia progresses and insulin resistance develops, the body's ability to compensate declines. Blood sugar levels start to rise, and symptoms such as fatigue, increased thirst, frequent urination, and blurred vision may emerge.
These are classic symptoms of prediabetes and type 2 diabetes. So early detection is crucial. But how can you detect a condition that doesn't have any noticeable symptoms?
That's where proactive health screenings come in. If you have risk factors for hyperinsulinemia, such as a family history of diabetes, obesity, or a sedentary lifestyle, it's essential to talk to your healthcare provider about getting tested.
So it's about being proactive and not waiting for symptoms to appear. What kind of tests are typically used to screen for hyperinsulinemia?
The most common test is a fasting insulin level, which measures the amount of insulin in your blood after an overnight fast. Elevated fasting insulin levels, even in the absence of elevated blood sugar levels, can be an early warning sign of hyperinsulinemia.
So it's like peeking under the hood to see what's happening at the metabolic level, even before any overt symptoms emerge. This underscores the importance of regular checkups and open communication with your healthcare provider. Now, we've talked extensively about the potential health risks associated with hyperinsulinemia. But before we wrap up our deep dive, I'd like to shift gears and talk about hope and empowerment. What message would you like to leave our listeners with?
The most important message I want to convey is that hyperinsulinemia is not a life sentence. It's a condition that can be managed, and in many cases, even reversed through lifestyle modifications and, if necessary, medical interventions.
This is a powerful message of hope. We have the ability to take control of our metabolic health. What are some of the most effective strategies for reversing hyperinsulinemia?
The same lifestyle modifications that we discussed earlier for managing hyperinsulinemia can also be incredibly effective for reversing the condition in its early stages. Adopting a balanced diet rich in whole foods, engaging in regular physical activity, prioritizing sleep, managing stress effectively, and minimizing exposure to environmental toxins can all contribute to improving insulin sensitivity and reducing insulin levels.
It's about creating a lifestyle that supports metabolic health. It's about making choices that nourish our bodies and minds. Are there any specific tips or tricks that you find particularly helpful for people trying to reverse hyperinsulinemia?
One tip that I often share with my patients is to focus on progress, not perfection. It's about making small, sustainable changes over time, rather than trying to overhaul your entire lifestyle overnight.
That's a great reminder. It's about taking a gradual approach and celebrating small victories along the way. Are there any other parting words of wisdom you'd like to share with our listeners as we wrap up this deep dive into hyperinsulinemia?
Remember that knowledge is power. The more you understand about your body and the factors that influence your metabolic health, the better equipped you'll be to make informed choices that support your well-being. Don't be afraid to ask questions, seek guidance from healthcare professionals, and advocate for your health.
That's excellent advice. It's about being an active participant in your healthcare journey. Thank you for taking the time out to listen to our deep dive. Until next time, stay healthy and stay informed.